let's continue on with some other common congenital heart defects. The PDA, not public display of affection, but a patent ductus arteriosus. So if you look at the diagram, there is a little canal that is between the aorta and the pulmonary artery, and that usually closes after birth or within a few days of birth. So you will see this defect very commonly in preemies. So what they usually do is they just tie these off, but if it's untreated, it can cause pulmonary hypertension, which is a very serious problem, and can cause lung damage, heart damage, and may actually need to have a lung transplant. So, these sometimes can be missed as well, especially in children that are premature. Coarctation of the aorta, a COA. So if you look at the diagram, you can see where the aorta has a pinch in it. So it's often in the area where the patent foramen ovale closed. So back when I worked at the Children's Hospital, we had a few kids that were sent in through sports physicals, through school nurses. And one of the things they checked is, they'll check your pulse not only on your wrist, but also in your extremities. So they'll do blood pressure on the upper and lower extremities and check pulses. And so if they're reduced in the lower extremities, that could indicate a coarctation of an aorta. These are repaired either by surgery, but that's less common. They do a balloon, like an angioplasty. They go in through the femoral artery, and they insert a guide wire, and they just use a stent, and they can inflate that area where that aorta is pinched, and they can just put a stent in there. So that's way less invasive than doing any type of surgery. If they do surgeries, they often don't do them through the sternum. They are able to go through the ribs on the side. So it's a little less of an invasive surgery than cutting the sternum. But they're out there. You will see these. Other common defects, tetralogy of Fallot. Tetralogy, 4 things, tetra. So these are very common, especially in kids that have Down syndrome. Very common in Down syndrome. Again, not every child who has Down syndrome is going to have a congenital heart defect, but this is one of the more common ones. So you have 4 things. You have a ventricular septal defect, and it's often pretty large. You have pulmonary valve stenosis. So the pulmonary valve is narrowed, so that leads to blood flow being impaired. Aorta lies over the ventricular septal defect, and as a result of that, all of that causes the right ventricle to hypertrophy, but not in a good way. Hypertrophy and make the heart not pump blood very efficiently. So it's usually going to need surgical repairs, oftentimes multiple repairs, surgeries, and ongoing follow-up. And so this is a real challenge, because if you've had something like tetralogy of Fallot as a child, and we said there are pediatric cardiologists who deal with this, there are fewer pediatric cardiologists or that specialize, who will see adult patients, or an adult cardiologist who has pediatric training. So most adult cardiologists are used to dealing with heart disease, heart attacks, heart failure, and they're not specialized to work with former pediatric patients. Another interesting defect, transposition of the great arteries, and this is the defect that is associated with the Accutane. So you can see it's a very serious defect, and you wonder, how can a child even live if they have this? So the aorta and pulmonary artery are reversed, and so it obviously leads to cyanosis and murmurs. So you are having oxygenated blood where there should be deoxygenated blood, and vice versa. So they need a surgical repair to switch, and that's basically what they do. They do a big switcheroo on the aorta and the pulmonary artery. So other serious defects, hypoplastic left heart syndrome. You may know Carolina Panthers tight end Greg Olsen had a child where the left ventricle was underdeveloped. And so he is doing very, very well, but back when I worked at the Children's Hospital, that was a very serious defect, and many children did not live, or the only option was a transplant. So they have really come quite a long way in dealing with many of these congenital heart diseases. Everything's just, the technology, the techniques are so much better, and the kids are left with a lot fewer complications.